Hello everyone, my name is Justin Mark. I am a second-year medical student at Nova Southeastern University, Dr. Kiran C. Patel College of Allopathic Medicine. Today I'm going to be talking about our project titled Factor V Leiden Screening in Reproductive Age Women, a Need for Shared Decision Making. So over 5% or 16 million Caucasians in the United States actually carry the Factor V Leiden mutation. In addition, there were over 9 million women of reproductive age who used oral contraceptives in 2015 and 2017. These risk factors together have a multiplicative effect on the risk of venous thromboembolisms in both heterozygotes and homozygotes, especially in women using oral contraceptives. Currently, there are no Factor V Leiden screening protocols. In contrast to this, certain conditions such as Lynch syndrome and cancers associated with the BRCA mutation are given Tier 1 status by the CDC. It is thought that when a condition is given Tier 1 status, there will be a positive impact on public health with knowledge of a positive screening. However, Factor V Leiden has not been eligible for such status due to a perceived lack of benefit in knowing this information. We contend otherwise. We believe strongly that given the high prevalence of the Factor V Leiden mutation and the use of oral contraceptives, women should be able to know their Factor V Leiden status. We hypothesize that with this knowledge, women would alter their care accordingly. We also contend that Tier 1 status may be warranted for Factor V Leiden. So we gave a voluntary anonymous survey to women at a local health center. We also gave them educational information regarding Factor V Leiden and various risk factors, including the use of oral contraceptives. We then surveyed these women to ask them if they would alter their care or care for their daughters with a positive result. We also asked if they would be willing to spend $150 for the test. Our results overwhelmingly show a need for reconsideration for Factor V Leiden screening, specifically in the subset of women using oral contraceptives. So remarkably, 88% of these women actually did not have any prior knowledge of Factor V Leiden. Almost 70% of them would be in favor of screening for themselves before use of oral contraceptives. 80% of them would be in favor for screening for their daughters before they were using oral contraceptives. 81% stated that they would seek alternative birth control if they knew that they were positive for the test. Over 65% of them were willing to pay $150 for the screening, and a remarkable, overwhelming 80% of them would be in favor of screening before pregnancy. So these very compelling findings suggest that when women are informed of Factor V Leiden and the inherent risks associated with oral contraceptives, they would certainly alter their behavior, including their choice of contraceptive, in order to reduce their risk of thrombosis. So we contend that there's actionable and medically significant changes that would result from Factor V Leiden screening. We also note the importance of shared decision making amongst physicians and these patients, and we assert the reconsideration for Tier 1 status for Factor V Leiden screening. In addition, we contend that clinicians do have an obligation to tell their patients not only just about Factor V Leiden, but also the increased risks given these findings. Currently, they believe actionable change would not occur given the situation. However, we certainly contend otherwise, and our findings support this decision. We contend also that screening protocols could drastically reduce the incidence of potentially deadly venous thromboembolisms, including pulmonary embolisms, and therefore mortality. Nonetheless, future studies should be performed to assess the need for widespread Factor V Leiden testing and even CDC Tier 1 status. Thank you very much.